and welcome to our next episode of our podcast series, Health Frontiers and Insights from our Global Experts. I'm your host, Dr. Kritika Upadhyay, and today I'll be interacting with a very prestigious person who's sitting next to me, Dr. Upendra Bujani, who is a public health expert and a senior fellow in the Institute of Public Health, Bangalore. We welcome you, sir.
Thank you, Kritika.
So our today's episode revolves around advancing health system and policy, and we are going to have conversation with Dr. Bujani. So Dr. Bujani has an experience in the field of public health from long back, and his expertise are in the field of health system strengthening and tobacco control. He's a tobacco control advocate from long back, and he is working in health equity and particularly focusing on the marginalized community. So I would ask you, sir, that your work spans along the health systems research and policy implementation. So what do you think that what leadership approaches are to be there in when we talk about the privilege, like the vulnerable communities or the marginalized population? So how the leadership concept take place and plays role in that?
Yeah, thank you, Kritika, for this very important question. I think, like many other questions in public health, I don't think there is a single answer or there is a right or wrong answer. To me, I think while many aspects of what we generally talk about strengthening leadership, maybe strategic thinking, communication, all of these are important. But when it comes to really bringing the voice of marginalized communities and within public health, I think to me what's more important for leader is to be very empathetic, to have some sort of direct experience. Sometimes the leaders have lived experience of those issues, or sometimes you'll have to invest in working with these communities. If that is there, then it's relatively easier to understand and connect with those issues and be truthful in representing their voices. Then, of course, you will have to then talk to those who matter, those who are in powerful positions, and that's another thing where one has to think about how those leaders would see, how those decision makers will see. So again, some sort of expertise in being able to frame issues and communicate about it in ways that you remain truthful to the communities and their challenges, but you are able to frame it in a way which will be more appealing and actionable for those in decision making capacity.
Absolutely, sir. I totally agree with you. So, if I give you an example, like you are working in tobacco control, and tobacco being a very challenging subject, especially if we talk about our own country, and so many stakeholders are involved, so many governments and ministries, and starting from the farmer to different levels are involved. So, how do you think if such kind of a challenge, being a tobacco control, is to be handled? What are the leadership tactics, or I'll say the policy interventions, are to be taken in mind if such kind of issues are there?
See, again, tobacco control is what in public health we call one of those wicked issues, where there is no single solution. So while it's important to problematize it, and I think after years of work, it's not been difficult. I think there will be hardly somebody who would say that, oh, that's not important. I think everybody thinks it's an important issue. The key for making change lies in understanding this complexity, in understanding that while tobacco is a terrible challenge for public health, there are other interests. There are revenue interest in it, there are profit interest in it, there are people whose livelihoods are engaged in tobacco. And as a public health person, while it's important to say that one should not consume tobacco, it's also important to understand that livelihoods are also important determinants of health, right? And so if one carries this complex understanding, then as a leader, when you engage in reforms or in convincing people to make reforms, you go to them with solutions, and with solutions which are not just one, but a range of solutions around some of the key sticking issues. How do we still support those whose livelihoods depend on tobacco? How do we protect some of these interventions which are evidence based but may not be that acceptable to industry, let's say, right? How do we how do we ensure governments that some of these interventions are not going to terribly affect their revenues, because in some sense the cost is also very high. So it's again it's more about understanding different aspects of the issue and going to decision makers in a framing and with solutions rather than problematizing it further.
Right. So, sir, we can hear that wisdom of yours through this communication. So, my question is a little personal, like from a dentistry background and turning out into a field of public health and then taking a subject which is very challenging. So, if the viewers are the young generation and young leaders like you, what key message you want to give so that they have a vision and but they are not able to implement it? So what do you want to tell them so that they can take that path if they are, interested in?
um, well I- Reflecting back, I think I'll highlight two things.
Right.
One is any kind of experience that one has is useful to public health, right? So nobody is inborn public health professional. I think public health is a very applied field. So even though I was a dentist and I worked as a dentist for a while at one of the Asia's biggest public hospital, what it taught me to connect with patients, to keep patients, or rather the people who are in need of health services, in the center and not forget them, because it's very easy to forget them while talking about policies. Second, it helped me to understand how health sector works. What is the psyche of healthcare providers, or how they see things, right? So I certainly learned quite a few things from that experience, but that's not all. It's only also the training that you get on job by learning. I think that there is some sort of merit in informally learning public health, which offers skills which probably individual disciplines are difficult to offer. It's quite an interdisciplinary field. So many of these things are can be learned, but I think at the end of the day it is a challenging career, right? It's I don't want to romanticize public health. I think it has to also come from something deeper within your side. If there is the hunger of making a social change, if there is a hunger of addressing inequities that you see around, then I think public health can be very satisfying kind of a career journey.
Agreed, agreed. So absolutely, sir, because we see that people these days, like the children who are coming up with the medical degrees, they think that we have nothing to do, let's go into public health. But I think, yes, that clear vision and what exactly you want to do for the public is to be clear, then only I think they should go ahead with the field of public health. So my last question would be, because you are an excellent researcher and you are drafting your words into either policy documents or research papers, maybe journals. So how do you make sure that what you write or what you're publishing is going in a right way to the community which you want to address?
Yeah, a very important question. I think as researchers, and I guess I speak about a larger research community. I think it's important to publish your research findings, let's say in peer-reviewed papers. It brings kind of validity to what you are doing. But I think that's only one of the ways we put things out. Yeah, if we really think that what you are writing or the research you are doing should actually change the policy or practice, then we'll have to really look beyond just publishing in peer-reviewed papers. More importantly, I think we have to develop skills to communicate our findings beyond research papers, and this can vary. So, for me, for example, I turn to art when it comes to engaging people, because I find it more relevant.
Absolutely.
They engage with art, and then it provides an avenue where you discuss about the issues. When it comes to policymaker, again, I started writing in popular media. I often write op-ed pieces in newspapers. I write blogs. I take opportunities to go along with somebody if somebody is meeting a decision maker. I think many of these things I felt has brought more influence on policy and practice than publishing papers. This is not to undermine. I think as a researcher you should publish papers, but you
Yes.
should do much more than just publishing papers if you think that research should influence policy and practice.
Absolutely amazing, sir. And I want to tell the viewers, like Dr. Upendra has told about, it's not just about publishing the research, it is about putting your words through different ways. And I have an artist sitting next to me. Being a public health expert, he portray his ideas through paintings and through sketching. And if you wish to get time to meet him, I think he's the right person to give you that guidance. I think, sir, your testament has given a vision to our viewers who will be watching this podcast. And thank you so much for sparing your time.
Thank you, Kritika. We all learn from each other.
Thank you so much.
Thank you.
And to our viewers, stay connected because we are coming up with other more global experts who will be sharing their wisdom with us. Stay connected. Thank you.